Hey, good morning, and welcome to the UroPatient podcast. I'm your host, Vic Sinise. We meet every Saturday at 10:30 a.m. Central Time. And if you're watching us live, we're on YouTube and Facebook Live every week. And you can always watch our on demand by going to our UroPatient.com website, where you'll find all of our past episodes. Also, the best place to go to get any of our handouts. We've got a bunch of them, so go and check those out. Every program I put out, I have a handout with valuable information for you guys. So let's get started with our show this week. So today's episode is going to be about kidney stones. Everything you ever wanted to know about kidney stones. So let's bring it in. So today we'll be discussing kidney stones, a common but often misunderstood condition. We'll cover what they are, how they form, symptoms, treatment options, and tips for prevention. Whether you've experienced them before or want to avoid them in the future, and trust me, you want to avoid them, this talk's going to provide some useful information. So let's begin. So first of all, kidney stones are hard deposits made of minerals and salts that form inside your kidney. These stones can vary in size from as small as a tiny little grain of sand to as large as a golf ball. They can develop when your urine becomes concentrated, allowing these minerals to crystallize and stick together. Not everyone with stones experience symptoms, but they can cause significant discomfort when they block the urinary tract. Now, here's an example of what some of these stones look like. So they're kind of, different shapes, different sizes, but they're all very kind of crystalline in look. Kidney stones form when there's an imbalance in the substances in your urine. For instance, if you have high levels of calcium oxalate or uric acid, they can form stone formation. Dehydration is one of the biggest contributors, as concentrated urine increases the likelihood of crystals forming. Other factors like your diet or genetics can also play a role. Understanding these causes is the first step in preventing stones. You can't get rid of calcium, because if you decrease your calcium, your body will just start leaching it from your bones. So what you can do if you have a calcium oxalate type stone is decrease high oxalate foods. And here's a list of those. Delicious vegetables like spinach and Swiss chard and rhubarb, all those good things. Some of the common fruits, though, I like blackberries and nuts and seeds. Certain nuts and seeds are high in oxalates. Chocolate, black tea. I don't have it listed here, but unfortunately, beer is high in oxalate too. So you have to watch those things. Kidney stones can cause intense pain, usually in the back or side, and it may radiate to the lower abdomen or groin. Blood in your urine is another common sign, giving it a pink or reddish tint. Nausea, vomiting, and frequent urination may also occur. If you've ever experienced these symptoms, you know how disruptive kidney stones can be to daily life. And kidney stones are actually considered the worst known pain to mankind. Worse than labor, ladies. There are different types of kidney stones, each with its own cause. The most common are calcium stones, which form when calcium combines with oxalate or phosphorus. So that's that oxalate that you can get rid of. Struvite stones are often linked with urinary tract infections, while uric acid stones are associated with diets high in animal proteins. We say anything that walks the earth is considered animal and can be high in these, what we call purines, which can lead to uric acid stones. Some people who suffer from gout also have uric acid kidney stones. Cystine stones are the rarest of them, and they're caused by a genetic disorder. So this is kind of an inherited stone. You'll find out that people that have had them, their family members have had it. Identifying the type of stone helps guide treatment and prevention. So diagnosing kidney stones typically involves imaging tests such as a CT scan or ultrasound to locate the stone and assess its size. Most common test is a CAT scan. It gives us the best example or best image of it. Blood and urine tests can help identify underlying causes. If you pass a stone, your doctor may analyze it to determine its type. Very important if you pass a stone to save it, because sending it out to find out what kind of stone it is can help prevent stones if you know exactly what steps to take. These steps are essentials for creating an effective treatment plan. Small stones often pass on their own, and with plenty of fluids and pain relievers, you can get rid of them. But larger stones may require medical interventions. Options include extracorporeal shockwave lithotripsy, kind of commonly called ESWL, ESWL, which breaks stones into smaller pieces, or ureteroscopy, where a scope is passed up to remove the stone. In rare cases, surgery might be necessary. Medications can also help prevent future stones. So some of the medications that are mentioned here are things like alpha blockers. They're commonly used to help relax the ureter. These are the things that are used for men that have prostate issues. Same drug like your Flomax or Tamsulosin. Pain relievers, of course, they're great drugs that try to help pass a stone because they can help prevent the pain that you are associating with stones. Again, dietary restrictions, we talked about those for prevention of stones, but they can also help by cutting back some of the things that are helping to make the stones, like the increased high oxalate stuff or cutting back on citrates. Now, sometimes surgery is necessary. Shockwave lithotripsy uses sound waves to break stones into smaller pieces, as I'd mentioned. I've got a whole talk coming up next week on that, so we'll go into that in greater depth. Ureteroscopy involves inserting a scope to break up the stones. For larger, more complex cases, we even go in sometimes with what's called a percutaneous nephrolithotomy, where you go in with a scope and right into the kidney and get the stones. And rarely now, pretty rare, we can actually do open surgery. We have to cut open to get to the stone, whether it's trapped in the ureter or in the kidney. Now, exciting advancements are transforming how we treat kidney stones, such things as laser lithotripsy, which offers highly precise stone removal, or even robotic-assisted surgery for enhanced accuracy in these cases. And improved imaging technologies are also enabling earlier detection and treatment of smaller stones. But prevention is always the key. Stay hydrated, drink plenty of fluids, especially during the summertime or when you're working out. It's an important step. You should aim for at least 2 to 3 liters of daily water. Reducing sodium, oxalate, rich foods like spinach, excessive animal proteins can also help. If you're prone to stones, talk to your doctor. They may recommend specific dietary changes or medications tailored to your needs. In addition to diet and hydration, regular exercise. We talked about that a few weeks ago, how you can prevent your risk of cancers, etc. Also help cut down on kidney stones. By maintaining a healthy weight, you can reduce your risk of kidney stones. Monitor your calcium intake. Too much or too little can contribute to stones. Remember, I told you can't get rid of the calcium because if you cut back calcium, you just take it out of your bones. For those with a history of stones, regular checkups and urine tests can catch imbalances early, helping you stay ahead of the problem. It's important to know when to seek medical care. Severe pain, fever, or chills may indicate a serious condition or obstruction that needs immediate attention. One of the biggest dangers is a stone blocking your kidney that can lead to something called sepsis, where you can end up with a severe infection going into your bloodstream, and you can actually die from that. Difficulty passing urine or persistent nausea or vomiting are also red flags. Don't hesitate to call your doctor if you're experiencing any of these symptoms. The good news is that most kidney stones are treatable, and prevention is highly effective with simple lifestyle changes. Many patients successfully pass their stones or undergo minimally invasive procedures with excellent outcomes. Advances in technology have made treatment safer and recovery quicker. And with the right approach, you can manage or even prevent kidney stones. So there you have it, folks. No fun to have a kidney stone, but there's lots of ways to prevent those and plenty of ways to treat them. So be sure to take care of yourself and check out for some handouts. We'll have some handouts about kidney stones on our website, and we'll catch you next week. I told you we're going to talk about those kidney stone treatment called the ESWL. So see you next week.